Let's show you.
No, 1.2.
That's an upload.
So much.
That's another 5 foot.
And then you split it in half.
Yeah. My hair's too short. I used to have really bad and they have like ribbons on them.
Yeah.
I finally got it done.
Good for you.
Now I'm finally done. For now.
And it sounds like you're
Not that I didn't thank you for
Huh? What did I do?
I want to do like a team, like all have the same hair.
Okay, everybody got
Where's
this
the
one?
braid my hair?
I got you.
Yeah, we should get you a wig.
Alright, so these terms are in Google Classroom. And this picture is in there showing the different orientation terms. These pictures are, you know, questionable, but kind of helpful.
Why is she in a speedo but she's in a one piece? Like, even if.
I did not choose these at the time.
You want the guy to be in a one piece?
No, I want to wear swim trunks and then she can wear.
You want her to wear a
I did not
bikini to make it
choose
better?
these pictures. But they do, like I said, I wanted you to get the definitions down and then I would show you a picture that kind of helps put them into terms. So we have medial, we have distal versus proximal, and we have the patient's left, patient's right, anterior, superior, dorsal ventral, those kinds of terms. This is another very helpful chart that is also in Google Classroom, telling the word, telling the definition, and giving some pictures showing the locations. Okay. So there are terms for different regions of the body. So that was directional terms. These are regions. Because science likes to name everything. Everything has to have a name. Now the body can be divided up into a few regions. There's the axial and the appendicular. Axial consists of the head, neck, and trunk. So basically everything except the arms and legs. And then you have the appendicular. Think appendicular appendages. Appendages are the arms and legs. So axial is head, neck, and trunk, and then the appendages, which is the appendicular. With that, you also have some very specific terminology, which is listed up on the board, which you also have a picture of in Google Classroom. Did I mention this is a 200 level class?
What's that?
What does that mean?
Okay, so probably don't know about this yet.
Yeah.
In college, the levels are based on, so if you take a 100 level class, it's a freshman level. If you take a 200 level class, it's a sophomore. This is a sophomore level class in English.
So was biology? What was
Biology was a freshman level course.
Then why do I have to retake biology?
Yeah, we failed.
That's
biology 1,000. That's biology.
Yeah, but it's a B that passed. B's are not happy.
You know how many?
Okay. It goes, Mizuda's 1,000.
Maybe it goes across the.
Huh?
It's the same thing.
Okay.
If
Oh.
it's a 1,
I was like,
then it starts with a 1, then it's a freshman level course.
There's
If
1,000.
it starts with a 2, then it's a sophomore level course. 3 are junior, 4 is senior.
Your biology course is kind of just intro
5
to
is a
biology.
graduate level,
That's
6
all I
is
need.
a doctoral level.
For biology, that's all I need was intro to biology, for my biology degree.
I have to say biology.
I know.
the amount of times I came to advisory, like,
You need something
Anatomy and
biology.
physiology are both 200
The
level.
biology, it will transfer, but it's not the biology. I need it for both my major and
6.
all my go credits are transfer. But I do take biology because I need it for my major and that's part of major ones.
Here are the back regional parts of the body. And you know, it's really not that bad when you start to learn them because a lot of them are relational to muscles of the body. So if you know some of the muscles, then you know some of the regions. Okay? It's not as scary as it may seem.
Yeah.
It's really not
I said that, I was like, that means you're hard.
it's really not that bad. Now,
first start of the year, and so.
Planes are like if you made a cut, like if you're cutting up the body. If you're dissecting something and you made a cut like a surgeon, then that's what the planes of the body are. So you made a sagittal cut. This divides the body into right and left parts. It could be anywhere on the body that you made a cut. But if you made it in the middle, if the sagittal plane that is exactly in the midline, so if you're going like this, like right down the middle of the nose, that is a mid-sagittal cut, or medial. Now, if you did a frontal or coronal, this divides the body into anterior and posterior. I think of it as like shaving. If you are shaving and you shaved a layer of skin off, like maybe you shaved your nose off, like that. You shaved your nose off. You got too close to a fan and you shaved your nose off. That is a frontal or coronal plane. Okay? A transverse or horizontal section that you get cut in half across the middle. But it helps you remember it. Transverse horizontal, also called a cross section. And then an oblique section is diagonal cuts. Bless you. And we're going to practice some of these. You figuring out what cuts there are. We're gonna practice some of them. No. We're gonna practice with some examples, and you have to figure out which one I'm talking about.
Who's heading up first?
You.
Visualizing in our heads, not actually.
That doesn't make it as fun. What?
She gives us the funny behind the like.
Carly, you interview.
That's where like
Don't scare the little one.
You know what you meant.
What?
I do.
Physiology.
I knew what you meant.
Really
But other
wasn't.
people probably.
It really wasn't.
It really wasn't.
Arguments in your head.
It was not that bad. What's not that bad? Physiology.
Actually, taking this before physiology is better. Blake did it backwards.
Well, you
And
didn't have a
he
choice.
still survived. You didn't have to.
Why are you shocked? No. You can't. Out of the house. Already? I've taken like 20 calls.
Alright, this is in Google Classroom showing the different planes. Even though they have pictures like this, I never really find these pictures super helpful. It's hard for me to visualize these 3D pictures when they've got these lines kind of through them like this. But the way I think of it again as sagittal is left to right, so if you're cutting down like this would be a sagittal. Frontal, think shaving, going this way. And then coronal, cutting like this. Or sorry, that's transverse. Transverse is cutting like this across the middle. And oblique is any kind of diagonal cut. So. Alright, so you are a surgeon and planning to do open heart surgery. You would need to make a blank cut into the chest cavity.
Blank.
Well, yeah, deep cut, but think of planes. Medial, but what kind of medial cut?
I got it.
I heard somebody say it.
Lateral?
Mid-sagittal.
Oh.
Mid-sagittal because
These terms don't mean anything unless I can see them. Pictures. That's what I'm about to find.
it would be deep eventually. First you start superficial, then go deep, but you'd be making a mid-sagittal cut. Okay? You have a patient that has gangrene in the lower part of their leg, and you need to amputate.
Keep on mode.
You would make a blank cut out through the leg.
Yeah. I sure hope so. I hope it's not diagonal.
Transverse.
Transverse.
Oh, is it transverse?
I feel like.
Oh, okay, okay.
Transverse. Yeah, transverse cut.
You're cheating, Aaron. Look it up. Yeah, right.
Just as cross section.
The abdominal muscles and muscles of the back are separated by the blank plane. Frontal or coronal?
That's into anterior.
Frontal or coronal? Okay, good.
Was different.
All right, that's enough terms for you for today.
That's it.
Oh.
What's the?
No, it felt. Where, guys?
Can you just?
Pace me up,
Sagittal is like left to right, like this. But if it's directly in the middle, then it's mid-sagittal or medial. But you could do like this, and it's not in the middle, so that would just be sagittal. Yeah, any cut that's going left to right.
Graduate from the message.
But if it's right in the middle, then
Not
it's
graduate from
mid-sagittal.
that.
No one can do that.
Yeah.
That's what it sounded like.
I'll be a junior.
When I heard
Do we
that's
need to
what
do
it sounded
assignment, or are
like.
we still
No,
working
no,
on it?
no.
Oh, I have an assignment. No?
Are you serious?
Again?
Alright.
Alright, fine, you can work on this one a little longer.
That's the wrong one.
Almost easier. I just watch the kids and give a paragraph a long time and give them.
That's so much easier.
I remembered to turn it off, the thing, I didn't remember to start it on time. I remembered to turn it off.
Daryl gets this, you say, oh, I'm gonna turn it off now.